Hey everybody, and welcome back to another deep dive here at Pharmacist Online. Today we're going to be talking about something that I know a lot of you are interested in, and that is the side effects of common diabetes medications. I know it can be a little bit confusing to understand what all the side effects are, when you should be concerned, and what you should do about it. So we've brought on a senior pharmacist to help us unpack all of this.
Absolutely.
And before we get started, I just want to remind everybody to like this video and subscribe to the channel. All right, so I guess the first thing that I'm curious about is what are some of the most common side effects that people might experience with different classes of diabetes medication?
Yeah. So, there are a lot of different medications out there, a lot of different classes, and they all have kind of their own unique side effect profile.
Okay.
So, for example, one of the most common classes of diabetes medications is called sulfonylureas.
Okay.
And these work by basically telling your pancreas to make more insulin.
Okay.
And one of the most common side effects with that is hypoglycemia.
Hypoglycemia, yeah.
Which is basically low blood sugar.
Right.
So you might feel shaky or sweaty or dizzy or weak.
Yeah, and confused, right?
And confused, yeah.
Yeah.
Another common class is called DPP-4 inhibitors.
Okay.
And these medications work by increasing the level of hormones in your body that help lower blood sugar. And they're generally pretty well tolerated, but some people can experience things like nausea or headaches.
Okay.
And then another class that's become really popular in recent years is called SGLT2 inhibitors. And these work by helping your kidneys remove excess sugar through your urine.
Interesting.
And one thing that people need to watch out for with this class is they can increase your risk of urinary tract infections.
Oh, wow. Okay.
So, yeah, so basically every medication comes with potential side effects.
Right.
It's really about weighing the benefits against the risks and figuring out what's best for you as an individual.
So I know you talked about like nausea, headaches, some of those kinds of things. What are some ways to manage those side effects if you are experiencing them?
Yeah, that's a really good question.
Yeah.
So the first and most important thing is to talk to your doctor.
Okay.
Because they can help you figure out if those symptoms that you're experiencing are actually related to the medication or if it's something else going on.
Right.
And sometimes, it might be a really simple fix, like adjusting the dose or the timing of your medication. But beyond that, there are some lifestyle changes that you can make that can sometimes help.
Okay.
For example, if you're having some gastrointestinal issues like nausea or diarrhea, sometimes just changing when you take your medication in relation to meals can make a big difference.
Okay.
And staying really well hydrated is always a good idea.
Staying hydrated is always a good idea regardless.
Exactly.
But especially if you're on these medications, I guess.
Exactly.
Yeah. So I guess this brings me to my next question, which is, when should someone really be concerned? Like, how do you know if a side effect is serious enough to warrant reaching out to your doctor? What are some red flags?
Yeah, so it's always better to be safe than sorry. So if you are experiencing anything that is severe or unusual.
Okay.
So for example, if you're having any trouble breathing or you have any sudden swelling or a rapid heartbeat or a rash, things like that, those are things that you should seek medical attention right away.
Okay.
But even if it's something that's not as severe, if you notice any significant or unexplained changes in your health,
Okay.
like if you're suddenly losing a lot of weight or you're feeling extremely fatigued all the time or you're having persistent vomiting, don't hesitate to call your doctor.
So basically you're saying if you're ever unsure, just go ahead and reach out.
Exactly. Exactly.
Better safe than sorry.
Yeah, because, open communication with your healthcare team is absolutely crucial. They need to know what's going on with you in order to provide you with the best possible care.
Awesome. This has been so helpful. Thank you for sharing all of that with us.
Of course.
And I think our listeners are going to really get a lot out of this. To just recap a little bit, we've learned that side effects can vary depending on the class of medication that you're taking.
Yes.
There are some practical ways to manage them, and there are some clear red flags that indicate that you should go ahead and reach out to your doctor. If you liked this deep dive and you want more information about managing your health, be sure to like this video and subscribe to Pharmacist Online.
Okay, absolutely. And remember, understanding these side effects really can empower you to be a more informed patient. You can have better conversations with your doctor and ultimately take more control over your diabetes management.
Knowledge is power.
It really is.
Well, thank you so much again for joining us.
Thank you for having me.
And thank you to everybody for watching, and we'll see you next time.